I am profoundly sorry and deeply regret that my professional activities as a doctor during the period covered by the inquiry led to the deaths and sufferings of so many people. In the late 1970s, I was responsible for the care of haemophiliacs in Merseyside and prescribed vials of commercially prepared factor VIII concentrate, many of which happened to be contaminated with viruses and led to the development of hepatitis or AIDS, and sometimes both. Within 10 years or so, many of these people had died, while others had to cope with the severe morbidity of chronic infection. AIDS was unknown at that time, but almost certainly some batches of the commercial products given in the late 1970s were contaminated with AIDS viruses originating from plasma bought by American fractionators. On the other hand, potential contamination with viruses causing hepatitis was well recognized by professionals, including myself, and not just in commercial products, but also from donations to the UK blood transfusion services. Although from the early 1970s, screening tests were applied to UK blood donations to prevent the transfusions of blood contaminated with what's thought to be the most common source of serum hepatitis, that's hepatitis B, it is recognized that these tests were unlikely to offer complete protection even from hepatitis B. And furthermore, that other hepatitis-related viruses, especially non-A, non-B, could not be detected even when present in NHS blood. Nevertheless, the professional consensus was that such infections were usually mild, often asymptomatic, and short-lived, so that the possibility of adverse consequences were often downplayed when advising the patients and their parents. I should have done my best to ensure that everyone who received blood and blood products understood that there were risks of transfusion-transmitted infections in the products they were using, although the degree of those risks was unknown. I was keen to extend the home therapy program for the haemophiliacs in Merseyside, and this was welcomed by the haemophilia community, especially the mothers of affected boys. Many mothers, on learning that they had carried the defective gene to their sons, felt guilty, although such carriage was actually a form of lottery. Nevertheless, many were keen to be trained by me so that they could deal with the consequences of their parentage and see the palpable relief of pain which would follow their administrations of factor VIII or factor IX to their young children. In no way can they be held responsible for the later sufferings of their children. After I left Liverpool in January 1980, I never saw those people again, although I note from some of the testimonies that the service to haemophilics in Merseyside may not have improved very much, if at all, until substantial developments occurred there under later haemophilia directors. The haemophilia community on Merseyside were great people, and I missed them. But it was proper to let my immediate successors take over from me completely. I have felt since that I sort of deserted them in never having, for example, to conduct the personal and difficult conversations. Although I also recognize the part that I played in this tragic saga when I was at Edinburgh, and paid tribute to my Scottish colleagues who tried so hard to improve the testings for transmissible infections, to increase donor awareness and hence improved patient safety, as well as the pioneering efforts to inactivate the viruses contaminating the plasma while retaining the biological clotting activity. The consequences of the contamination of Scottish factor VIII concentrates revealed in November 1984 were permanent and will never leave the affected patients, their families, myself, my Edinburgh BTS colleagues, and the Scottish haemophilia directors and other people who administered the treatments. I am therefore very pleased that this inquiry is taking place, and hope that those people and their families who suffered and survived, and the families of those who died, obtain full recognition of their sufferings. I extend this, of course, to any recipient of UK blood who suffered from the contamination of that blood. I want no excuses, but hope that everyone gets a clear explanation, enabling them to develop an adequate sense of closure. Thank you.